phenomenon that we use the concept in treatment a lot, and it's referred to a lot, and that's kind of what we call a brain reboot, or rebooting the brain in recovery. And I just kind of want to explain what that is all about, what that means, and how it works, and why we need to do that. Basically, with all these intensity addictions that we deal with at Seeking Integrity, whether it's sex addiction or porn addiction or chemsex, that fused drug use and sexual acting out, they all have this phenomenon in common, and that's they work with the reward circuitry of the brain, which is that old part of the brain that gives us little shots of dopamine when we're doing stuff that we need to be doing to help us survive as a species. It feels good, whether it's good comfort food or collaborating or being loved or hugging or even sex. Orgasm is the most dopamine we can get from a natural reward. But we know that all these addictions really hijack that system. They take it and they run with it. For example, an orgasm is the highest amount of dopamine we can get from a natural reward. But even nicotine is stronger than that, gives us more dopamine. Cocaine more than that. Sex and porn more than that. And methamphetamine, I think, is the king at about 13 times the normal amount of dopamine. So addictions take that system and hijack it. But what happens with that is that as we reset that level of stimulation, our baseline for feeling good, for feeling even normal sometimes, gets higher and higher, so that we can't achieve that unless we're doing something addictive. And this often happens when we pair addictions or fuse them. And it can be drugs and sex, or just say porn and sex. So it's very common, for example, if we pair pornography and masturbation, that this level of setting gets higher and higher, to the point where people start to have erectile dysfunction. And that's a phenomenon we're seeing now in 20-year-olds who are getting erectile dysfunction because they have a constant diet of pornography from an early age. And we can see it with chemsex, where we had paired methamphetamine, for example, in sexual behavior that gets paired together. And after a while, people can't function sexually with their partner, or with any human being for that matter, or achieve pleasure. And there's a concept that explains all this in neurology, and or a slogan, which is simply what fires together wires together. And we know that if we do things repeatedly, one thing at the same time as the other, eventually the brain will kind of put those together. And so they become entangled or undifferentiated. So the impact of that is that if, for example, a chemsex addict gets clean from drugs, oftentimes the sexual feeling, sexual desire that was so hooked into that intoxicated state goes right with it. So people will be clean and sober, but they have no sexual desire for 3 months, 6 months, a year sometimes. And we know we need to incorporate that healthy sexuality back into our lives. So the brain kind of gets reset up into this really high state where it needs a lot of intensity, needs a lot of stimulation. And in recovery, that lifestyle and being clean and sober just doesn't give us that level of stimulation. So the healing process that we talk about for that is to basically reboot the brain, to allow the brain to resettle from that very high level of required stimulation to feel good, or as I said, to even feel normal sometimes, back to a kind of a lower, more human scale phenomenon. So it really allows the brain to reset. Couple rules of thumb in doing this. One, time. And everybody else wants to know, okay, how much time does it take? And that really varies by individual. So it can take a month, it can take 3 months, it can take longer for some people. But what we do know in that period of time, whatever it is, there's a couple important rules. One is that you really want to avoid any kind of artificial stimulation. So what does that mean? That means pornography, clearly means drugs and alcohol, but fantasy thinking in our heads. And that's a problem sometimes, because those guys that I was mentioning, and women, by the way, the chemsex addicts, who get clean and sober and whose sexual desire goes with it, oftentimes the only way they can get an orgasm, even without using drugs, is to fantasize about one of their old chemsex fantasies. And as with pornography too, they get kind of escalate into darker things, taboo things, more rougher things, and that really isn't conducive to recovery. So it's a problem when people do that. So it involves staying away from that kind of artificial stimulation. That may be pornography. For most people, it is pornography. And it may be requiring breaking free of orgasm, not having an orgasm for a while. Because as I mentioned, orgasm is the single most rewarding thing we can do. And I think if you can allow the brain to reset, it kind of settles down a little bit. We know that masturbation can be a problem. So oftentimes, and those are the two things, by the way, that people often do, is stop masturbating, stop having an orgasm sometimes, and avoid pornography. And that really allows the brain to kind of resettle. A lot of people have questions about, what about sex with my partner? And that's really individual. Oftentimes we see that sex with a person, again, can really be healing and start to reincorporate sexuality and desire into that human one-to-one contact. But if people start to rely on fantasies or scripts in their head, they're getting back up into that addictive thinking. And we know that can happen even while someone may be having sex with a human being. They may be playing out scripts or fantasies in their head. And that's obviously what we don't want to do. So remember, all these feelings, sex addiction isn't about being horny, right? Using methamphetamine or cocaine isn't about needing to feel good. It's about an addictive and behavior that really suppresses a lot of uncomfortable feelings. It numbs. It's an escape from life. It buys people some time away from the humdrum normal parts of their lives. So it's really important to remember that the cues that drive us into these behaviors aren't really having to do with sex drive or anything else, but really it's like a medication. We're self-medicating. And so as we reboot our brain, a lot of those feelings that were kind of suppressed or numbed or kept at bay with those behaviors are going to start to pop up, and that process even more difficult. So a couple tips I found, especially with chemsex clients, don't try to substitute other behaviors or drugs. So for example, oftentimes with methamphetamine, I mentioned it's such a strong drug. If that's involved in this combination or fusion of drugs and sex, that oftentimes has a huge kind of dopamine release that goes with it. So people will say, well, methamphetamine brought me down. I never had a problem with alcohol. Why can't I have a beer? And so what we find is that alcohol, even if you're an amphetamine addict, can really reduce your desire to stay clean and sober. And oftentimes people will relapse with no intention of using chemsex, for example, after having a beer. So we really want to keep that, we want to be aware of that. We also want to be aware of what we're doing with our arousal template. And remember that arousal template is that map in our head of what we find sexually desirable. And we know that a lot of those pathways, the kind of common patterns in the arousal template, really have to do with addiction. So we get into a few very intense scenes sometimes that really are triggering because they may be totally related to our addictive behavior and the fantasies related to addictive behavior. So we can be not acting out, we can be not using drugs, but still thinking about those fantasies, and that can be a problem as well. And that just keeps the brain from really doing the resetting task that it has to do. One of the things I recommend for people, if they do re-engage with a human being in sex, is to really not try to be in their head, but to drop out of it, to drop into sensations. What does it feel like? You know, what are you feeling in your body? Are you tense? Are you relaxed? What are the sensations? Do you like it? Do you not like it? And as a sex therapist, we recommend an exercise called Sensate Focus, which is really rediscovering. It's an intimacy communication exercise where there's a pleasurer and a receiver, and the pleasurer basically tickles, pinches, caresses, hugs, and the partner gives feedback. I like that, I don't like that. And it's a kind of a give and take that really starts out as a non-sexual exercise. It could lead to that ultimately, but it's just a way of rewiring our brain to approach sex and intimacy in a different way than that deep kind of groove that we had with our addictive behaviors. And it's so easy to slide back into that right away that we have to really make a conscious effort to learn new ways to be sexual and intimate and to reignite sexual desire that isn't really associated with our addiction. And really the best way to do that is just to kind of let everything cool off and to allow the brain to reset, and it does. And I think that's the final message I want to say tonight, is that a lot of people feel so hopeless when they give up sex addiction or porn or chemsex, even though it's really brought them to their knees, it's destroyed their marriage, it's ruined their lives in many regards. They really have to grieve the fantasy of all that hot action. And that can be a real barrier to this recovery. So I think letting go of that, being patient, and knowing that you'll get back to normal. And that's why I think going to meetings is so helpful, to see people that are down the road and for whom sexual functioning has returned, for whom they have really healthy, satisfying relationships with their partners. I have clients in long-term recovery who say the sex with their partners is so much better than it ever was on methamphetamine or with porn or in some kind of addictive way. So give yourself the luxury of that time for a brain reboot if you need it. The brain has to resettle and relearn how to do things at a human pace. And I guess that's it for that. Thanks.
Thank you, David. If you have questions about brain reboots with addiction or anything else, we suggest you use the Q&A feature, and David and I will answer your questions for you. I did want to tag on a little bit. David talked about porn-induced erectile dysfunction, PIED, PIDE. And it's very common. We see it all the time with even young guys in their sexual prime. The interesting thing about it is these guys can perform perfectly fine with porn. They have no struggles getting it up or having an orgasm with porn. It's when they step away from the porn and try and have sex with a partner, or the stimulation of a single human being, no matter how attractive and how much you love that person, is not enough. It can't compete with the porn. And if there's meth involved, oh my God, it really can't compete with that. I deal with a lot of guys in my that I sponsor or just talk to who are new to recovery, and they're wondering if they're ever going to be able to have sex again. Whether it was porn or sex addiction overall, suddenly they get into recovery and nothing is fun. They can't get aroused. They can't even laugh at funny movies. And I walk them through what David just walked everybody through, which is, give it a while. It's going to suck for a while, and that's okay. That's normal. And most of the guys I find, and David, you may find this as well, are relieved to know that it's normal to be in a funk for a couple of months or 6 months or even a year or longer. For chemsex addicts, I think it's more than a year in my experience.
Right.
But there's a relief to knowing that there is a light at the end of the tunnel.
I think really kind of normalizing that experience, and it's very true with the chemsex guys as well. I kind of explain what's going on in their brain and why they're feeling what they're feeling. That's why relapse is so high with these intensity addictions, because it's so hard to kind of let go of that and feel normal. There's one, without getting too much into the weeds, there's a kind of interesting phenomena there with how the brain, as I mentioned, dopamine is this feel-good neurotransmitter that when we have excessive amounts of it, whether because of meth or cocaine or some kind of addictive behavior, we feel good, we feel great. And as the brain is trying to cope with these high levels of stimulation, it's basically, it like turns down the volume by shedding dopamine receptors on its own. So it's saying, I'm having so many inputs of stimulation with all these dopamine receptors, let me get rid of some. And so they do come back, but they take months to come back. And so if somebody gets into recovery, their brain has adjusted to this very high level of stimulation intensity. And without the intensity coming in, it's like somebody turned the switch off. The brain is still kind of wired at this point, volume of stimulation. And so without the stimulation coming in, there's like almost, and there's a term called anhedonia, which is inability to experience pleasure, which is, Scott just really perfect example of it, like not being able to laugh at movies or feel joy or feel pleasure or feel, everything's just kind of gray. And that does pass, but it's like a physiological thing that is part of this brain healing process. So really important.
And all addicts experience that to some degree. Heroin addicts have a term for it. They call it, chasing the dragon or chasing the beast or feeding the beast, or where they're not trying to get high anymore. They're trying to get back to zero. They just want to feel normal, because that's as good as it can get, no matter how much heroin or whatever it is they put into their body. The best they can do is get back to zero.
Right.
But, want to encourage everybody, ask questions, use the Q&A feature or the chat feature. And I have a question for David. This came up in my SAA group last night. We had a really good meeting, and the focus was on what is healthy masturbation. And basically everybody said, I have no idea. And it brings the whole reboot conversation to mind for me. It's like, of course we don't when we're in our addiction. How long does it take to get back to healthy masturbation? And how can people figure out what's healthy and what's not healthy?
Wow, great question. I always go to the source. Well, what's the inspiration for the masturbation? Is it, and by the way, there's a lot of guys think, they're going to die if they don't have an orgasm. This, people can go a long time and not have an orgasm and survive. So that's one important thing to keep in mind. But I think if people remember that sex addiction is all about using sex to kind of manage feelings in a not very and so it's a great way to numb, to dissociate, to distract, to kind of escape. It's not really about being horny or being sexual at all. And so I think in recovery, it's really important to look at the source of that masturbation. Is it a way to kind of deal with tension? Is it a way to kind of get off in one's head and escape? Or is it really something about an erotic interest? And I think that's a really critical piece to examine, because sex addicts and chemsex addicts are so used to using masturbation as a way to soothe, to self-soothe oneself. And I think, and not doing that, by the way, you're gonna have people have problems with sleep, people get tense, people get anxious. I mean, there's all these other side effects because we're taking away kind of that medication piece. There is a term that's floating around called mindful masturbation. And I think that's an interesting concept as well, in that I think masturbation can be quite healthy depending on our mindset as we approach it, what we're doing it, and what we're thinking about as we're doing it. Or if we're someone else, so there's mutual masturbation sometimes. But I think if we are engaging in some of those addictive fantasies, if we're up in our heads with those old scripts, that's no place we belong. And so I think masturbation can be a healthy thing. I think people have to be mindful of what's the context in which they're doing it, the kind of the setting, and what is their experience while they're doing it. And I think to really stay out of the realm of addictive behaviors. And I think the other piece to mention, I haven't said it today, is that, recovery, we want to be really sex positive. This is not about, shutting down sex or being prudes or saying sex is bad or only heterosexual sex is the only way. We're saying none of that. People should be as sexual as they can be in a healthy way, in a way that sustains them and sustains their partners. And sex should be fun. Sex should be exploratory. Sex should be entertaining. But if it's in this addictive context, it's just none of those things. And so I think to really just be aware of it. Over the years, I've had clients that started to engage in masturbation early on in recovery with no problem. I had other people who tried it and it was just too triggering because their heads automatically fell into those old scripts and they had to give it more time. So I think and it's very frustrating for people in recovery to hear that there's no set time. Because like every client wants to know, well, at day 80, I can do this. And it just doesn't happen that way. So patience. I think part of that reboot, by the way, is not just it's the physiological reboot as well, but it has to also be a shift in our attitudes about sex. I mean, sex is often scary for somebody in recovery because they've never really been vulnerable and dealt with the intimacy issues before. And so to really deal with all that, but really embrace it as something new. For a lot of the guys I work with who are gay, the gay guys who have used drugs all their lives, I call it a second coming out. These people are experiencing what it's like to be a gay man for the first time without, including all the nervousness and self-doubt and all that stuff, without the benefit of drugs to distract them. So sex is really, it's raw, to use a bad term, in terms of in your face, no screen. But boy, it's beautiful too. And I think when we see people in recovery walk through that, it's great. And I think masturbation, when it's engaged in a healthy way, can be a huge tool toward that. But I think it's tremendously, I think it requires caution. And Scott, I don't know how you approach this with your sponsees, but I think total transparency in recovery is really important, and including something as powerful as masturbation. And so I think, although sometimes people may be reticent to ask about that because it's a private thing, I think somebody in recovery really needs to share their masturbation habits with their sponsor, because I think it's an important part of the trigger. At least, I mean, timing, frequency, that kind of thing. At least as a therapist, I want to know that, because people can really get off into some secret areas again, which aren't good for recovery.
Yeah, I absolutely discuss masturbation with my sponsees. Everything sexual with my sponsees, from flirting all the way up to, full on acting out. I just want to say that my computer is very, very low on power. So if you lose me, hopefully the session will stay alive.
Okay.
And I don't have my cord with me. I'm at our facility here in Los Angeles, our treatment center. We got a couple questions here. Is there something natural, an herb supplement, food and activity that can help replace the loss of dopamine and mitigate some of the blues?
That's a great question, and people are madly searching for that because this phenomenon is so pronounced with the addictive disorders that we see today. Dopamine is the key factor here, and there's other neurotransmitters as well. But so people are looking at ways to replenish dopamine quickly, and there's been all kinds of experiments from an antidepressant like Wellbutrin, which works with dopamine. Nothing has been truly effective. There's some infusions testing now where people get dripped with different things. The one thing that's kind of easy and accessible to everyone that we know is exercise. Physical exercise actually creates some of the precursor chemicals that dopamine builds on. And so we find that exercise is useful. But I think just given a recovering lifestyle, the dopamine will respond fairly quickly. The dopamine gets regenerated fairly quickly. The problem is the brain is kind of in a mad dash to build the way it distributes the dopamine. It has to rewire all those pathways. It does to some extent, and not everyone has the total damage. In a chronic meth user where there's actually kind of a functional brain injury from all the methamphetamine, it can take up to 24 months for that system to rewire. It doesn't always take that long, but there's no shortcut, unfortunately, except the one thing I do recommend is exercise to help that. Okay, here you, Scott.
In our we did our clinical consultation session yesterday. One of the therapists asks about ADHD drugs, things like that, and whether they can help stimulant addicts sort of walk through that depression. I'm going to go look for a cord that might work in my computer. Okay.
And I'll speak to that too. It's sometimes one of the approaches for stimulant addicts like meth or cocaine is to keep them on some other amphetamine as a treatment, like Adderall, for example. And my experience with that has just been, it's kind of disastrous. I really don't recommend that in any way, because it's like really making that person in recovery live with a very vivid experience of having an amphetamine in their system. And it just is a constant battle to just switch amphetamines from one to the other, from meth, for example, to Adderall, Adderall to meth. And so I think it's really important for us to really keep that from happening. And so even being in the mindset of substituting one thing for another, because in recovery, without getting to that idea of we need to set up a drink or some kind of medication or herb, experiencing it ourselves. But it's a great question. I think we may have lost Scott, but we can do this ourselves. So another question from Donald. Sorry, I guess Scott doesn't say the names. Thanks so much for both the topic and the specific techniques of sensory exercise and focus to help to accomplish the reboot. I realized I actually did this with my husband during the first year of recovery, and it has worked out very well. However, due to some real fears about the power of my arousal template, I was frankly afraid there would always be something against which I would have to struggle. Can I count on a periodic reboot to move forward the way I would like to? What a great question. So it's really important stuff to talk about. So as I've mentioned, this arousal template, this map of what we find attractive, what we find appealing, really gets kind of morphed or hijacked by these intensity addictions, sex addiction, porn, chemsex. And what I mean by that is we've talked tonight about how the intensity kind of needs more and more. And so people get into these very specific fantasies. And we talked about how people need to have ever increasing stimulation. So for example, a lot of my clients will start out with kind of, what we call vanilla, kind of normal sex. But to get that stimulation, we'll get into more taboo stuff or rougher stuff or more public things or kinky or whatever it may be. And that really takes that arousal template and kind of switches it. And those specific fantasies that are related to the addiction get kind of so hot that they become very hard not to just fall into automatically. I grew up in the northern part of the United States. We had a lot of snow, and we had, if you drive a car through snow, there's tire ruts. And those fantasies that are addictive related create really deep ruts. So even if you're trying to avoid it, you kind of fall into it very easily. Now, what happens, the bad news about arousal templates is that once something is in there, it doesn't really come out. Kind of like that old Roach Motel ad, it goes in. So if I find that I have in my addiction discover some kink for, I don't know, knee-high leather boots, to use a really bad stereotype, and nothing else will do it for me, knee-high leather boots are always going to be on my template, even if I have years of recovery. And so the danger there is that I could always reignite that. So I can't ever get rid of it. I can't pull it out of my template, but the best I can do is kind of avoid it. And the metaphor I use is a walk in the woods, right? If we're out in the woods and I have that my kinky fetish for boots, and I keep going there to have an orgasm, I'm path in this woods, and I'm keeping it open, right? There's no overgrowth. It's just kind of a thing. It's open. Everybody can see it. It's very easy to walk down. But if I go there, if I avoid that, I want to let it grow over, let that path get kind of hidden under the undergrowth, and so I don't have to go there anymore. So, and that's really a very effective strategy and the best we can do. So that's a long way of saying those particular elements of your arousal template are always going to be there, but they become dormant and they become long forgotten. And if we don't really, after a while, make a conscious effort to keep them alive, they will kind of fall asleep and go away and not be so bothersome. But I think it's really important to be aware that if we play around with them, if we mess with them, that's why I recommend, if the masturbation piece that we spoke about a few minutes earlier, it's so important to talk about mindful masturbation or using, because if we're masturbating, and if I'm masturbating in recovery but thinking about my kinky boots, and which is fine in and of itself, but if it's related to addiction, then that's a problem for me. So I think that's something to be aware of. So just be patient, try to find other ways of stimulating, reignite other things in your arousal template, but you really want to avoid those fantasies, the disturbing, kinky, erotic fantasies that are associated with your addiction that may be problematic. They're not going to necessarily go away, but you can kind of let them fall asleep, and so you don't notice them. And often, most of my clients, after a while, forget about them. So not to worry, but just have patience. Are you back, Scott? Sort of. Okay. So we have another question here. My spouse says he hasn't watched porn in 10 months, but continues to behave in all the ways he did when he was. Total lack of responsibility, no communication, continual denial, constant lying. Even when confronted with his lies, he will deny and lie more. How can he say he has no triggers or urges for porn and stop that, but seems to have no sense of reality? So again, I think these are some of those cases we find where people have stopped one aspect of the addictive behavior, but they're keeping the mentality alive in different ways. I think Scott and I have talked before in this webinar about friends each of us have in our different 12-step fellowships that we attend, who may have years and years in recovery. There's a guy I'm thinking of now who has 20 years of clean time, from alcohol, and he's the angriest person I've ever met. He's clearly not in recovery. So what is he doing? I think he maybe stopped the behavior, and it's probably extremely difficult for him because none of the attitudes changed. And so there was no, I think, an incomplete surrender. I think there's a lack of acceptance. I think there's an inability to turn things over to some kind of higher power. I think all the steps, those elements of the steps that we find so important, really, that person I would suggest aren't doing them. The other thing that may be happening, and I do see this again, as I mentioned, with the chemsex guys and the porn guys, and sex addicts too, if they are keeping elements of their fantasy, their addictive fantasies alive by masturbating to them, by even thinking about them, indulging in them for longer than that 3-second rule we talked about, that can keep that stuff alive as well. But if I see that kind of denial and behaviors and kind of a don't believe your lying eyes kind of thing, that really, to me, says that there's just one portion, if that, of the addictive behavior that's been surrendered. There's a lot of attitude problems there, and probably some, I would say it's a really slippery slope. If that person isn't already using some kind of addictive behavior, I would suggest that they could well be on their way to that. So meetings, support, for you, I would really recommend support as well, because it's so hard, like a constant battle to sort of say this is real, right? I mean, I think partners become the ones that speak the truth sometimes in this crazy kind of upside down world of addiction. And it's really important for that partner to get their support as well. And I think we found that can be in a support group of partners. It can be in some of the fellowships that are designed for partners of addicts. But to really kind of face that barrage of like upside down, through the looking glass kind of stuff by yourself is really hard. So I do hope you have support and adequate resources for yourself, because really it's going to come down to you taking care of you and hoping that your spouse can get as much help as he can. So sorry about that. The communication, by the way, you say there's no communication. We found really communication is so essential for partners early on, and that can be, well, I found just a lot of my therapy sessions sometimes, especially with couples, talk about effective communication. I think, you know, when a couple has gone through something as difficult as addiction, we get into patterns of conflict, and sometimes we can start an argument. We don't really hear each other. If my husband starts to yell at me, I'm really not hearing what he's saying. I'm starting to formulate my rebuttal, and back and forth like that. And so these effective communication exercises really help us slow that whole process down. And so that there's a brilliant couples dialogue and a kind of couples therapy called Imago, where there's a series of steps. But the first step is simply repeating what the person just said. And by doing that, it forces me to listen. So, you know, if my partner says, you know, I think the sky is blue, and I say, well, I heard you say the sky is red. And it sounds kind of ludicrous, but oftentimes in couples therapy, that happens. People are not on the same page with their communication. And so by simply repeating what I heard my partner say until he says, yeah, you got that right. And then I can respond, and vice versa. So it just slows down the communication, and it really, if I'm the speaker, having that affirmation from the listener that at least he may not agree with what I've said, but at least he's heard what I said. And I think so often in arguments and addiction, couples are talking past each other. There's denial, there's blame, there's, you know, running for cover verbally. And then, by the way, after that effective listening and repeating the phrase, we get into more empathy building. You know, I can understand how you would feel that way, and so on. So it's really a way of reestablishing those baseline communications. But I think the ability to listen and communicate is so healing for everybody. And it's not just, by the way, in a primary relationship. It can be in a meeting. It can be with a sponsor. I mean, all these relationships in recovery are new. They're new patterns. And I think it's an opportunity to to reestablish healthy communication. You know, the one other thing I'll mention that I hear a lot people complaining about in the context of healthy communication is that someone will want to say something. If I want to unburden myself on a friend or a sponsor, and I'm sharing something deep and vulnerable with that person, oftentimes I just want to be heard and witnessed. I don't necessarily want that person to jump in and give me feedback. And I think sometimes we as listeners want to kind of like fix it. And sometimes that person doesn't want to be fixed. They just want us to hear the pain they've been going through without having to try to find a solution. And so I think that's something useful to remember. The other big taboo in that realm is if somebody's sharing something meaningful with you, to not make it all about you. And I've seen clients do this in couples therapy too, where somebody will be unburdening something, some painful feeling or expression or incident, and the person that's hearing it will say, well, you know, let me tell you about the time that happened to me, and suddenly they've kind of hijacked the conversation. So it requires sensitivity to the communication, to the listening, and being open. It also requires being vulnerable. So all those things need some sobriety, and if you have an active addiction, it's going to throw all those patterns into a difficult state. So that's that. That's all the questions we have in the queue. So I'd encourage everybody to keep asking. Remember, we do have a topic about rebooting the brain tonight, but you can ask about anything. This is your time to ask me about anything about addiction, which is kind of terrifying for me because there's a lot of stuff. I know a lot, but there's a lot I may not know. So hopefully I'll have some answers for you if we do get that. I'm looking at my notes of other things we could talk about. You know, we talked about kind of re-engaging sexually and with intimacy. And of course, if there's a lot of anger or mistrust, it's going to be really hard to do that. And that's why we recommend that couples really just take their time and that both partners have support in the terms of therapy and in terms of support groups, because it's going to be really hard to have effective intimacy with someone with whom I'm really angry or with someone I don't trust. When people do come together, it can be an incredibly healing experience. I've seen a lot of couples really, after some time, reestablish that vulnerability and trust, and as I say, have deeper intimate relations than they had even before. So that's important. I will say I encourage people, and I'm a sex therapist, when I'm working with couples in this arena, it's really important, I think, to not stay in your head for the addict. And so what do I mean by that? These intensity addictions, sex addiction, porn, chemsex, they're all about scripts up in one's head. So I've had a lot of meth clients describe it to me. They may be having sex with a body, with a person, a living person, but that person is totally objectified. And they describe it as that person being kind of a prop for the fantasy that's playing out in their head. You know, they're not really engaged in a vulnerable way. They're not experiencing intimacy with that person. They're not pleasing that person in a selfless way, and all those other kinds of emotional vulnerabilities that are important for sex, but they're really kind of living out a fantasy in their head. So one of the things that's important to do is, when they do re-engage sexually, is to really start to stay out of their head and just be real. You know, I mentioned this before. What are people experiencing? What are they feeling? What's the reaction of their partner? I am a big believer in energy. What energy is this? What are you feeling in here? What's going on? Does it feel good? Does it feel bad? Does it feel open? Is there trust? Is this pleasing and healthy? Is this mutual? And so on. So I think to really look at ways that sex and intimacy can be mutual and healthy versus some addictive patterns where it's more selfish and exploitive and doesn't result in the person feeling very good about it. So please ask questions. No more here. Here's a few. So what is the average reboot time? Does the lack of connection prolong it? So again, this is that $64 million question, the time. So depending on how long the person's been engaged in the addictive behaviors, depending on what those are, it can vary. It can vary from some people as fast as a month, which is rare. I've seen 3 months. I think more often it's sometimes between 6 months and a year is more typical. And I think sometimes just anecdotally, because we're still trying to do research on these phenomena, anecdotally we know that if people really avoid pornography and the masturbation, initially it's going to happen faster. And we also know that if, Scott mentioned at the beginning of our webinar, there's a new type of sex addict, these porn addicts, these young men typically who grew up on pornography. That's been their sexual partner. In fact, many of them have not had sex with a human being, who are in their 20s, totally hijacked by pornography, can't function with a person. The younger someone is when they start this reboot process, the faster it is. So, but there's all kinds of factors that go into it. I think patience is the key watchword here, and also to really not be keeping it alive by going to those arousal template fantasies we spoke of and that kind of stuff. But everybody wants to know the answer. I think probably typically 90 days, just really start to feel some benefit. And I think really start to get back to normal functioning within 6 months to a year. Some people take longer, but that would be more typical. Does the lack of connection prolong it? You know, this is one of the tragedies, I think, of meth addiction. Unlike sex addiction, I think with sex addiction, almost always the addict has a partner, often a partner that's really concerned and upset and wounded and traumatized by the experience, but they're hanging in there often. In fact, at Seeking Integrity, when they get a sex addict come in for treatment, almost always there's a lot of partner contact and working with the partner. The chemsex guys, methamphetamine particularly, they tend to burn up their relationships so that oftentimes they don't have anybody. They have very few people in their support system. And so they do have this lack of connection. And I think it's for them, because they don't have a partner, because re-engaging with anyone sexually can be triggering. It kind of sets off that whole hookup sex pattern. It can be really hard to explore some of the intimacy that we see, the intimacy relationships. So yeah, it's important to monitor that. But I think it's helpful if you have a partner you can practice these things with. It's not essential. But it could slow you down. But again, depending on the individual, it might not have that connection. But patience. Another question. How would you explain to your recently betrayed spouse that the acting out behavior is in fact an addiction and not a continual bad choice? That's a great question as well. I'm not sure you can, frankly. I think we can't overstate the level of trauma that partners experience. You know, sometimes these patterns have been going for years and years. They think they're married to someone, that their relationship is stable, that they know what their lives look like and feel like, and suddenly the bottom drops out and there's this whole other person and sometimes secret lives and people, and it's incredibly unnerving and traumatizing and upsetting. I think intellectually, spouses, I think, first come to realize if they get the support and are treating and allowed to express some of the feelings they need to express, I think those spouses will intellectually come to realize this is an addiction, but it's going to take a while for that to move into really believing it and trusting it. And I think one of the key goals of any addict in recovery is to have their spouse believe that this time is different. Because very often the addict genuinely feels this is different. I feel different. I'm in recovery. I want things to change. And the spouse is much slower in terms of giving away their vulnerability. So I think what we try to do is explain to the spouses that about these addictive behaviors, what they're like, and the fact that it is acting out of impulse or lack of impulse, I should say, impulse control. But to really convince the spouses that this is a different thing can be problematic. And I think it's going to take time. So I think we spoke of communication a few minutes ago. I think communication is the way to go here. And each, both the spouse and the addict having their support systems and really re-engaging with some guidance from professionals. But just as a rule of thumb, the spouse is always going to take a lot longer to give away their trust, if they do. Most do, but it depends on the relationship and how damaged it's been. Okay, another question. I'm 56, gay, and have always been single. You've mentioned healthy masturbation, but it really sounds like going completely sexually dry. No porn, no masturbation, no sex is probably best for a reset. This sounds really difficult since I've been masturbating since 8 or 9 years old. How can this really be achieved? It's a great question and a great comment. And I think it's problematic. I think someone who's been masturbating for that long is clearly using masturbation not just for sexual release, but for some of that self-soothing we mentioned, maybe to deal with emotions, to for kind of private me time, whatever the motivation may be. I think it is basically allowing the brain to reset by giving up those behaviors, and temporarily. This is not forever, but it's something that requires